Brazil has recorded more than 4,000 coronavirus deaths in 24 hours. By far, its worst day since the start of the pandemic. The country has now recorded more than 330,000 deaths in total. The health system has been overwhelmed by a surge in cases, with thousands of infected patients unable to get a hospital bed. Paul Adams reports.
Overcrowded hospitals, a health system on the brink of collapse, and a population living in fear. COVID's spotlight has ranged across the globe and now has Brazil locked in its harsh glare. For the first time, the country has recorded more than 4,000 COVID-related deaths in just 24 hours. Brazil's death toll now stands at around 337,000, second only to the United States. Still behind both the US and Britain in terms of death per capita, but a contagious new variant is fueling the latest surge. The death toll in March twice as high as the previous month.
I think Brazil now is not only the epicenter of the pandemic worldwide, is a threat to the entire effort of the international community to control the pandemic in the planet. If Brazil is not under control, the planet is not going to be under control. It's not going to be safe because we are brewing variants, new variants every week.
The country's defiant President Jair Bolsonaro continues to oppose a lockdown. Damaging the economy, he says, would be worse than the virus itself. Without citing evidence, he's linked quarantine measures with obesity and depression. He's even tried to reverse restrictions imposed by local authorities.
What we are facing here in Brazil, what we have here, it is a sad situation that is the consequence of the lack of coordination in the federal level by the national government that we have here. It is President Bolsonaro confronting governors and mayors.
The government is under pressure. It knows the world is watching with a critical eye. The country's new foreign minister says there's a balance to be struck.
E o presidente Bolsonaro instruiu-me enfrentá-las.
This is urgent, and President Bolsonaro has instructed me to face this mission. I emphasize the urgency of health, the urgency of the economy, and the urgency of sustainable development.
Scenes like this are undermining confidence in the government. The president says 2021 will be the year of vaccinations, but fewer than 10% of Brazilians have had their first jab. Some say much more drastic action is needed. Paul Adams, BBC News.
Well, earlier I spoke to Dr. Danilo Maxugi, a cardiologist working in the intensive care unit at One Sao Paulo Hospital.
Yesterday was a very catastrophic day. More than 4,000 deaths is a really scare. We also continue to see an increasingly of younger population in ICU, of course, not a scientific data. And what worries is the quick deterioration of clinical status of the patient. Probably this new cepa is more aggressive.
Yes, let's talk about this new variant, because I was reading this morning there are up to about 92 variants that exist in Brazil, but is it the Manaus variant that is of most concern right now?
Yes, because this is more transmissible and the people are more on the streets for now, and this became the situation very dangerous for everybody.
At your hospital, are there enough beds? Do staff have enough PPE? Just tell us what it's like there.
Oh, we need to open new ICU beds every day. Every day we need to make some training for these new professionals that are going to work in the ICU. And this kind of situation is very, how can I say for you, it's very difficult to maintain the balance of the situation.
And what about the vaccine program in Brazil? Because we saw there in our piece, only 10% of the population so far have been given the vaccine.
Yeah, there are two that are produced here, but not on large scale, despite of the efforts of Butantan and Fiocruz Institute. Vaccines purchased externally will not be available immediately, causing a delay of vaccination. I'm sure that if we had more vaccines, the situation would be better. Brazil has a very good public vaccination program, and the acceptance of vaccines in general here is very high.
President Bolsonaro has now appointed his fourth health minister. Are you confident that he will be able to implement the right changes to turn this around?
We hope so. But the problem is that every day we watch someone of the president team and your sons giving contradictory information to the population. This is a political scenario of polarization, keeps people away from the reality. It's common to see people think that the number of deaths is not so high, or seeking ineffective treatment supported by these statements. We hope that the new minister can change it.